Okay, so here we have the anatomy of the lower limb, and here we're going to focus on the thigh muscular compartments. So there are three thigh muscular compartments, and before we talk about them, we're going to appreciate this guy here who is called the fascia lata. So the fascia lata basically encompasses the entire thigh, though it's going to have segments. So here you see the iliotibial tract. Okay, no, this is not part of the fascia lata. This one is just, some chima band, from the side. But you're going to have things like the fascia lata anterior lateral. You're going to have the fascia lata posterior medial, different parts of it, but basically the entire circumference of the thigh is encompassed by the fascia lata, the entire of the circle, this entire thing. Now you would have more fascia that is coming from the femur, which is the bone itself, all the way to the fascia lata, and that is what is called the intermuscular septa. So you could have one coming from here, from the femur. So the femur is this one here. So you could have one coming from right about here, and it goes all the way up into the fascia lata there. So you're going to call that an intermuscular septa because it's forming a septum in between your muscle compartments. So you have compartment 1 and then you have compartment 2. Okay, so that could be a septa. That could be a septor. Now there are 3 septors and 3 muscular compartments. So septum number 1 is this guy here. Septum 1 is coming from all the way here up until here, and this one is called the medial septa, and then septum number 2 is going to be from all the way here to the back there. This is called the posterior intermuscular septa, and then septum number 3 is in the sides here. Septum number 3 is like from here to here. Okay, so this one is going to be called the lateral septa. So we have the posterior there, we have the medial there, and then we have the lateral here. So between the lateral and the medial, you're going to have the anterior compartment. Between the lateral and the posterior, you're going to have the posterior compartment. Between the posterior and the medial, you're going to have the medial compartment. And these are the thigh compartments that you have. Here was it, anterior compartment. Alright, and then now let's change the view of how we're looking at these compartments and look at it from, okay, no, technically we're still not changing the view. Okay, we're looking at it from the top, but let's just see the actual muscles that are found in each compartment. Now, a quick run through is that we've talked about the fascia lata and we've talked about the intermuscular septa, where we had 3 of them. Yeah, so from there now, we can map out those intermuscular septa, and then we can also now map out the individual muscles found in each compartment. So let's start with the anterior compartment. So question number 1 is, what septa encompasses the anterior compartment? So we talked of the medial septa, which should be right about there, and we talked of the posterior septa, which should be right about there. And then we talked of the lateral septa, which should be right about there. And then circling this thing, we said, is your fascia lata. So this is what we said. Now, when we start looking at the individual muscles that are making up these compartments, and then we said we'll go and start with the anterior. So we have this muscle in front here, which is called the rectus femoris. Rectus femoris, and then from there we also have this other guy here who is called the sartorius muscle, and then from the sartorius muscle we're going to have this guy here who is called the vastus medialis muscle, and then here we have the vastus intermedius and the vastus lateralis. So a simple way to remember this is that all those that are close to the femur are going to be called vastus something. These guys here, vastus. So according to the way they are arranged. So this one is the most lateral, so that's vastus lateralis. Most medial, vastus medialis. Intermediate, vastus intermedius. As simple as that. And then we just have the separate ones, which is this is the sartorius muscle, and then this guy here is the rectus femoris. Now, what you should know is that these guys here are actually called the quadriceps femoris. These entire guys here are called the quadriceps femoris. Quadriceps femori muscle, quadriceps femoris. So when you look at your rectus femoris, vastus lateralis, vastus intermedius, vastus medius, these are going to be called your quadriceps femoris. quadricep femoris. Quadricep femoris. So quadricep because there are 4. Femoris, on the femur. Yeah, 4 of them. 1, 2, 3, 4. All right, good. And then we have the sartorius one making the 5th one. Okay, so that's the anterior. Now we look at the posterior compartment. Now looking at the posterior compartment, let me take you right about here. So the posterior compartment has the following muscles. So this muscle here is actually one muscle. This one is called the bicep femoris. But it has 2 parts. So it has a long head and a short head. So the thicker part that you're seeing is a long head. Then the thinner part that you're seeing is the short head. Yeah. So here we have the short head, this one here, and here we have the long head, this guy here. All right, and then aside that, we also have these other muscles such as the semitendinous muscle and semimembranous muscle. So that's the posterior compartment. What intermasticular septa make up the posterior compartment? You should know that by now. But there is a little part of this muscle here. This muscle is called the adductor magnus. There's a little part of the adductus magnus that kind of encroaches into the posterior compartment. We call it the tibial part of the adductus magnus. Is also a part of the posterior muscles of the thigh. But the entire abductor magnus is going to be part of the medial compartment. And aside the adductor magnus, we're going to have other muscles such as what? We're going to have the adductus longus itself, or the adductus magnus. We're going to have the adductor longus and adductor brevis, and this other guy called the gracilis muscle, or the gracilis. Okay, but there's another muscle that we can see here. It's called the pectineus muscle or pectini muscle. It's also in the medial compartment, but we're just going to see it from this view. And there is one muscle that I forgot in the anterior compartment. Thank God I've remembered that one. So look at the anterior compartment, and you're going to see the 6th muscle that is going to appear. There it is, 6th muscle. So the 6th muscle is this one here. This guy here. What is his name? This guy is called, articularis geni, or genus muscle, articularis genus muscle. So now we've talked about the individual muscles that are found in each compartment. Let's talk about what the overall role of the compartment is. Now this is going to be with respect to 2 major joints that we're going to have. So we have the knee joint, and then we're also going to have the hip joint. So what does the anterior compartment do to the knee joint? What does the anterior compartment do to the hip joint? And all the other 2 compartments. So when you look at the anterior compartment here, so this anterior compartment, if you have a person lying flat like that, and then let's say the anterior compartment, so the anterior compartment is going to be on top here, and these anterior compartmental muscles in the thigh contract. What is going to happen to the knee, to the hip joint, is that the leg is going to go up like that. So when the leg goes up, we're reducing the angle in between your body trunk or your abdomen and your lower limb. So that is basically flexion. So with the hip joint, these guys are going to flex. But what happens to the knee joint? So the knee joint there, so let's say the leg grows, like longer. So this is the leg. So this is the thigh, and then this is the leg. Is called the leg. So basically, you're going to have some of these muscles in the anterior compartment of the thigh attaching to the anterior aspect of the leg. So what's going to happen is that when these guys contract, they're going to cause this angle that is at the back here to increase. So they're going to cause extension of the knee. So this is what the anterior compartment does. So it causes extension of the knee joint, but causes flexion of the hip joint. All right, this is what they do. So that is going to be the exact opposite of the posterior compartment, because basically what's going to happen is that if this posterior compartment here of the thigh contracts, and some of the muscles on the posterior compartment also attach to the leg at this point. So if they contract, meaning they'll be decreasing the angle of the leg there, so meaning they are flexing the knee joint. That's the posterior compartment. So on the knee joint, these guys are going to be flexing because they're reducing the angle from the back. But then from the hip joint here, if they contract, meaning they're increasing the angle that's here, meaning that they're what? Extending extending what? They are extending the hip joint. So it is the exact opposite. Right, it is the exact opposite. But the medial compartment only has an effect on the hip joint because the medial compartment controls movement in sideways, and your knee joint can't move sideways. That is a classic pathology. Knee joint can move sideways. Now, the medial compartment, basically from the names, they're all adductors. Adductor longus, adductor magnus, adductor brevis. So it basically adducts, but it adducts with joint. This is going to be the what? The hip joint. The hip joint. Chop off. Adduction. And please, it's adduction, not abduction. So adduction is where you have where you're going to have what? So you're going to have like a person here, it's got a person here, and then my hands here, make my head there. And then if your leg is moving to the medial side, that's adduction. If it's moving to the lateral side, that is abduction. So this is ad, and then this is abduction. Abduction. So these guys here, these are the adductors, and these are the medial compartments of the thigh. So that is the overall. Okay, so we've looked at the compartments, we've looked at the muscles, and here's a little something to help you cement those muscles in your head. So let's think of it like this, yeah? So the people in the front are always given the greater task, yeah? The people who you put in front, yeah? So these are the anterior group muscles. And then the people at the back usually have biz, like those my guys that are back bencher. You never find like a high pitched guy at the back of the class. No, they're usually guys who speak, like buzz, those deep voices. Wait for me to have a deep voice. You people will suffer. And then in the medial side of the thigh, you will notice that between your two legs there is a gap. Okay, so the medial compartment of the thigh is found in between your two legs, and in between your two legs you have a gap. So what does this task, buzz, and gap stand for? So the T stands for the tensor fascia lata. The A here stands for the A here stands for the articular geni, and then the S here stands for the Sertoli muscle, and then the Q here stands for the quadriceps femoris, which are those four groups of muscles. We have the rectus femoris. You're also going to have the vastus medius, vastus intermedius, and vastus lateralis. So this is going to be your task. And then from your buzz, so your B is going to be your biceps femoris, where your biceps femoris is going to be broken down into two also. Where you have your long head, then you're also going to have your short head. And from there, you're also going to have A, which is the adductor magnus. And then the adductor magnus, we said specifically the ischial part of the adductor magnus. The ischial part of the adductor magnus forms part of the posterior compartment. And then this S is a semitendinous and semimembranous. Then you are going to have G. G from the medial compartment, this is the gracilis muscle. And then A are the adductor muscles. So you're going to have the adductor magnus, adductor brevis, and adductor longus. Adductor longus. So adductor brevis, magnus, and longus. Then P, we said, is the pectineus muscle, but we didn't see it. But don't worry, we're going to see each of these individual muscles in a live view, and we're also going to see their individual action, their attachment, and their origin. Everything is going to be shown by the end of the video. All right. From there now, we can appreciate the specific nerves that innervate these muscles in each of the compartment. Now, the mnemonic is not so great that I came up with, but it's a little something for you to build up on. So, what was that? Morphad time. So Morphad, I said the medial compartment is going to be innervated by the obturator nerve. So you're going to have the obturator nerve. That's the medial compartment. And then the femoral nerve is going to innervate the anterior compartment. Femoral nerve innervates the anterior compartment. And then the medial compartment, or medial compartment is already obturator. The posterior compartment, that is going to be the sciatic nerve. Okay, yeah, see, I don't know what the T is doing here, but yes, the posterior compartment is done by the sciatic nerve. Posterior compartment is done by the sciatic nerve. That's the posterior compartment. Yeah, so those are the compartments. So looking at the specific nerve and tracing how it exactly innervates each of these muscles in each of these compartments, we're going to look at the following diagrams that we have here. So these are the diagrams. Okay, so here we're going to start with the anterior compartment, and from the anterior compartment, if we follow our Moffat, not such a great mnemonic, but hey, it's something. Anterior compartment, the femoral nerve. So we're going to have the femoral nerve coming from here, and then this femoral nerve is going to branch into two. We're going to have the anterior division is the one in green, posterior division is the one in red. So the anterior division is going to innervate your sartorius muscle. So in our mnemonic that said task, this S here is going to be supplied by the anterior division, and then when you look at the posterior division, it's going to supply everything else. So from this task, you have things like articularis genus. You have things like the quadriceps femoris. So the quadriceps femoris is going to be all these three guys here, and also the rectus femoris. The rectus femoris is going to be innervated by the posterior division, while the anterior division is only going to supply the sartorius muscle. Is only going to supply the sartorius muscle. Yeah, go and find out what the tensor fascia lata is innervated by. Tensor fascia lata. So that is the anterior division. And then from the anterior division, you're going to have the posterior division. So the posterior division is going to be innervated by the sciatic nerve. So this is the posterior division. So in this sciatic nerve, the sciatic nerve has got two parts. It has the tibial nerve and the fibular nerve. So the fibular nerve is also called the common peroneal nerve. But as it is passing through the thigh, it comes as one. So the fibular division or the common peroneal division only innervates the short head of the biceps femoris, whereas the tibial division innervates everything else. So what was our mnemonic for the back? We said buzz. The back, the mnemonic is buzz. So from this buzz, we're saying that the biceps femoris, the short head specifically, is innervated by the fibular division or the common peroneal division of the sciatic nerve. And then the rest, so we're going to say the long head and everything else that is here is going to be innervated by what? Is going to be innervated by the tibial division of the sciatic nerve, but generally just the sciatic nerve. Alright, and then from there we can go to our last division, which is our medial division. So with our medial division, we said Moffat, M-O, so that M-O, this obturator nerve. Obturator nerve is also going to have divisions. So we're going to have the anterior division being here, the posterior division being here. So the posterior division is going to supply the adductor magnus, and then every other muscle is going to be innervated by the anterior division. Yeah, so just take a really good look at these diagrams and take a look at how they're innervating, where they're innervating. But the overall take home is that the anterior division is supplied by the femoral nerve, the posterior division. So the anterior division is supplied by the femoral nerve, the posterior division is supplied by the sciatic nerve, and then the medial division is supplied by the obturator nerve. This is the take-home point. Everything else is just additional data. But otherwise, this was what we have. So next up, I think I should be able to show each individual muscle and how they are going to be contracting and the like.
Alright, so have you heard of vacuum stride before? Yes sir. What is vacuum stride? Gait disturbance, urinary incontinence, and dementia. What is the triple regimen for treatment of keloids? Excision, low-dose radiotherapy, and steroids. What is the normal range of intracranial pressure in an adult that is in a standing position? 10 to 15 millimeters mercury. That's good. I hope you are planning to come back here to practice. When you finish, I want to see you come back here to practice. Yes, what is stroke? Stroke. You've heard of it before, right? I think so. Okay, so give it a try. I know there's something in your mind. I know you want to say it. I don't want to say it. Okay, but don't worry, just try. Even if you are wrong, we'll correct you. That's why you are here. If you knew it, you'd not be students. Okay, and you said you've heard it before, right? Yes, sir, I've heard of it. Okay, so try, say something, don't say anything. What is stroke? I think it is the past tense of strike. What is the past tense of strike? Stroke. My God. Am I wrong? Yes, of course. You are wrong. Remove that stethoscope from your neck. So, which nerve supplies the sartorius muscle? Yes, sir. Radial nerve, sir.
No, now. Sartorius is in the thigh now. What are you saying?
Yeah, you are wrong. No, sartorius is in the hand. How would that come like this?
Guys, sartorius is in the thigh.
You are missing it up.
Shut up!
Me or them?
You, of course. What's your problem? Go and bring the working delay. The working delay is crying. So it's because the working delay is crying. What's your problem? God forbid in the next 5 years they rush me to the hospital and I say I had the doctor there. I'm in soup.
We are all in soup.